name is Jocelyn, and I will be performing a blood draw on my patient right here. So the way we're going to do this is I am going to explain the supplies I have, I'm going to explain my procedure, the way I do it, and then I'm going to actually do the procedure and show you how to do it step by step. Okay, so the first things first is I'm going to walk you through the supplies I use and the supplies you need to be able to do a proper and safe blood draw. First things first, you're going to want to make sure you have PPE for you. So this includes the coat as well as gloves. You're going to want to make sure you have, obviously, patient. You want to make sure you have your table, a tidy towel. You want some gauze, coat band to wrap it up when it's done. Of course, the hub and the needle, which is how you get the blood. The 2 tubes or 1 tube, depending on however many blood draws you're doing, that can vary. Tourniquet, alcohol pads, and then something to label your tubes with. Now, the most important thing you want here when you are doing a blood draw is also going to be a hazard bin. This hazard bin allows for you to safely remove the needles from the environment. And so yeah, you're going to want to make sure you have one of these. Anyway, let's get started. So the first thing I'm going to do is start off by identifying my patient. So, hi, my name is Jocelyn. I will be your medical assistant today. Can I have you verify your name and date of birth? And I'm going to have you spell your name, first name and last name out for me.
KYLEEGARRIS 100107.
Perfect. Okay. Now that the patient has identified their name and their date of birth using 2 identifiers, I am now going to perform the procedure as well as explaining it to them. So, first things first, Kylie, the doctor has ordered for me to take some blood from you. The way this is going to work is I'm going to stick you with a needle, I'm going to take out some of your blood, and then we're going to send your blood off to the lab to get tested for whatever the doctor wants to test it with. Okay, and one more thing. You want to make sure you ask your patient 3 questions before beginning. So, Kylie, have you ever had your blood drawn before?
Yes.
Okay. Were there any complications with that blood draw?
No.
All right. Do you have an arm preference?
This one.
Okay. Now you're going to ask your patient to roll up their sleeves if they're wearing any, or just put their arm out, and this guarantees that you have implied consent, which is very important when you are going through and doing procedures with your patients. So the first thing I'm going to do is begin by palpating her veins. So by doing this, I'm going to take a tourniquet and I'm going to put it on about 2 to 3 inches above from where I'm going to actually do the injection, or not the injection, the blood draw. So you're going to put it like that. I'm going to ask her to make a fist, so Kylie can make a fist for me. And right there, that vein right there is where I'm going to go. You can kind of see it here, but you also want to make sure you palpate to feel it. So yeah, that's where I'm going to go. So release the tourniquet, put it off to the side. What you're then going to do is you're going to take your alcohol pads and you're going to go in a circular motion and clean off the area really well, making sure to get out on like the actual other parts of the skin. Okay. Next thing I'm going to do is I'm going to take my gloves and I'm actually going to put these on. You want to always make sure that when you are doing venipuncture or any sort of injection that is going into the skin, you want to make sure you have gloves on, because it's a lot safer if you do. Okay, so now that I have all the equipment ready, you want to make sure you always have your gauze and your tube on your non-dominant hand side. Make sure you always have your needle on this side, and then everything else can pretty much just go. Just make sure it's out of your workspace. So now what I'm going to do is I'm going to take the tourniquet and put it back on Kylie. And then if you really want to, you can repalpate the veins. So what you do when you repalpate is you take the little wipe, you wipe your finger on it, and you tap. Now that I know where I'm going, I'm going to pull back in the direction that her vein is going in, and I'm just going to simply go in just like that. I'm then going to take the tube and I'm going to put it in. So then what you're going to do once you get the blood, you're going to wait, release the tourniquet, pull the tube out, take the gauze, soft set. So once you have soft set, what you're going to make sure to do is apply this safety on your needle. Once you apply the safety, you're going to tell your patient to apply pressure on the gauze. So Kylie, can I have you apply pressure on your gauze? So what you're going to do, you're going to take care of this. This should go in your biohazard bin immediately. Once that is done, you then are going to take your tube and you're going to label it. So I'm going to speed through this, but my patient's name is Kylie Garris, and you also want to make sure you know how to spell your patient's name. I've done this many times before, so I do know her name. Kylie, can you verify the spelling of your name?
Yes, that's right.
Perfect. And her birthday is 10/01/07. The time of the draw is going to be about 2:53. The date of the draw is going to be 12/2/25. And then my initials should then go on the bottom. Kylie, can you verify to make sure all of the information on that is correct?
Yes.
Perfect. Okay, now that Kylie has verified what I put on here, I'm gonna make sure I invert it. So this is gonna be inverted 8 times. That is 8 times. So if you're required by your doctor, or not if, when you're required by your doctor, you will put this in a plastic bag, but because this is for educational purposes only, I'm going to be putting this tube in the biohazard bin. And that is how you safely dispose of it. So now that my patient's all good, I'm gonna go over here and check on her. You wanna make sure the bleeding has stopped with your patient. So Kylie, your bleeding has stopped. What I'm gonna do is I'm gonna take some new gauze, and I'm just gonna take only a bit. You're gonna fold it up, and you're gonna apply your Coban. Around it. Okay, now the Coban is applied, you wanna make sure you tell your patient to take it off for 20 minutes. So Kylie, once 20 minutes is up, you're gonna remove that. Okay. Now that that is all done, your patient is taken care of, everything is good. You then are gonna clean up your workspace, wipe it down, and get it ready for the next patient.